Welcome to MedNation, everybody, the podcast where healthcare meets the real world. I'm your host, Dr. David Farnan, and today we're tackling one of the most misunderstood questions in medicine. Why do patients keep doing things that hurt them even when they know better? With that said, to help us answer that, I brought in someone who understands the brain, the behavior, and the body, and who's been through her own version of that battle. Brooke LaBarbera is a Nashville-based clinical therapist with over 15 years in mental health, addiction, and trauma. She holds a Master of Social Work from NYU, very impressive as usual, specializes in DBT, EMDR, and trauma intensives, and works with clients facing addiction, chronic illness, PTSD, and more. She's currently responsive, LGBTQ positive, affirming, and neurodivergent inclusive, and she brings a deeply personal dimension to everything she does. Brooke, welcome to MedNation.
Thank you for having me. What a very kind intro.
Well, it's well deserved. Brooke, I knew you grew up in Nashville and were raised by two clinical psychologists yourself and went on the real world, actually, everybody. Spoiler alert, you went on the real world Denver at 24. What was that experience like? And did you know that and did you know then that you were heading toward a career in mental health?
No idea. I was heading towards a career in mental health when I joined the real world. I definitely, at that point was wanting to be an actress, model. I was really into all of that, very much into the performing, and I did plays in high school, and it just kind of felt like this was the trajectory that made the most sense at that time, that I was going to eventually move to Los Angeles and make it big. And actually, I was found just 2 weeks after moving to LA to audition for the real world. So didn't take me long. Um,
Yeah,
and then,
the city of
you know,
dreams.
yes. And then, reality TV is of course different than actually doing real acting. But I figured I have this chance. I need to take what I can get. And then, of course, I had a much more difficult time on the show than I ever anticipated. I thought I was going to be going on this show and making, you know, six new best friends, but instead it was a lot of, adversity and people not getting along, arguing, things of that nature that I was very innocent and just had not had a lot of experience in. I'm an only child, so I didn't have siblings that I was used to arguing with, and so that dynamic was pretty tough on me. After I left the show is when I kind of started, auditioning for different things. I stayed in Los Angeles. I did get some things, and they were clearly things that I would have to take my top off for, and I did not want to have to do that. And so I remember I met with my career coach at a coffee shop after an audition for something I got, but then during the table read, it was clear that, the line was the character takes her top off and gets in the hot tub. I thought, this is just not really what I had in mind. And he looked at me and he just said, "You are too damn smart to stay in Hollywood. You need to go to graduate school." And that's exactly what I did. I applied at USC and I applied at NYU. I didn't get into USC, but I got into NYU. The rest is history. I went to NYU and got my master's degree in social work.
Yeah, that's an incredible story. It's got the lights, the fame, and you see that in a lot of these heavy megastars, and you don't have to be a megastar to have that, which is us to our next thing, personal recovery and what it actually takes. So you've been very open about being in recovery yourself. How does your own lived experience inform the way you work with patients?
Gosh, that's a great question. So for me, I'm in recovery from a lot of things. There's obviously the substance use disorder piece, specifically alcohol use disorder. I've actually never talked about that publicly, but I'm comfortable doing that because I'm celebrating 10 years next
Thank you.
month. And
Congratulations.
so this is kind
Congratulations
of in
to you.
honor of that. I'm
Yeah.
willing to talk about it 10 years into it. And I'm in emotional recovery. So what that means is, I no longer allow myself to act in ways that maybe I once did, although I still struggle, and I'll be the first to admit I have really bad Italian temper that I got from my Italian side of the family. But it's more than that. It's about not beating yourself up constantly, not allowing the negative talk get the better of you. It's about, talking to yourself with kindness and lovingness, the way that you would talk to your child, or the way you would talk to a friend, or the way you would talk to a patient. So that's kind of, to me, one of the most important pieces of my recovery, because any kind of recovery is shrouded in shame, right? So that shame piece is what really proliferates the entire experience of addiction.
Yeah.
It is what, kind of feeds it, so to speak, right? So the shame, I've had a lot of shame through the years. And I think it's because I'm somebody who came from a very good family. They're both doctors, they're both, high achievers. I'm the only child. I'm expected to, um, you know, be great all the time, right? And that
Yep.
comes with a lot of pressure, right?
Does.
It does. And so with that perfectionistic tendency can come a lot of shame, even when supposed shameful event that has happened is really not that terrible of a deal, right? Now, that's my personal story with shame. Now, for other people's personal story with shame, it could look a lot different, right? There's people out there who've had a way harder time in their lives and have gone through way more than I could ever imagine. And their shame story is so extreme that it's all they can really think about. It's what kind
Yeah.
of just, proliferates every aspect and every thought of their being.
Hmm.
So, I think for me, I have a pretty non-judgmental approach to working with patients. I know that no matter what it is somebody's done, no matter what it is that somebody is struggling with, I'm gonna understand. And I'm gonna understand, one, because I'm 44 years old and I've lived a lot of life and I've done a lot of things. And I'm gonna understand because there's something about just being one of those people that maybe has been shamed or has experienced deep shame because of addiction, because of emotional control issues, because of mental health, because of trauma, because of whatever it is, right? Perfectionistic tendencies. I get it. And I get it because of my learned life experience. So I do feel this is something I'm very good at, and I very much understand. I'm able to kind of meet patients where they're at with this. The biggest like problem with the whole thing though is a patient actually wanting to change and wanting to, still think that they're worthy of recovery, that they're worthy of, sobriety, right? So that's the piece for me that is probably the most challenging is how to actually help someone that self-esteem is so low in the gutter that they don't think they deserve help. They don't think they deserve something different, a better life, right?
Yeah. Yeah. Which ties into the next question. And, we constantly see this in our practice. It's interesting because you can extrapolate that all across, although very different, of course, right?
Yes.
But we constantly see in our practice that diabetic patients is a perfect example. They come in for wound care every week, whether they've lost toes, whether they've had these bad infections, limb life-threatening infections. And, I feel they want to heal and we want to help them heal, but they're seen eating Wendy's and drinking a Dr. Pepper bedside, and their blood sugar isn't controlled, and they know better, right? And their lifestyle hasn't changed despite these efforts, and the wound keeps reopening or not getting better or keeps getting infected, and these people keep going to the hospital, losing toes, what have you, limbs, what have you. What is happening psychologically in that loop?
I think it is a combination of things. I think it's one, to try something different feels extremely daunting to a person that is struggling with any kind of addiction. So trying something different feels uncomfortable. I know prior to my getting sober, I would think, well, no, that's for other people.
Right.
That's for other
Yeah.
people who deserve a better life. That's for other people who can manage, going to a restaurant without alcohol. I can't. I can't.
Mhm.
I'm not one of those people,
Right.
right? Is what I
Yeah.
would tell myself prior to recovery, right? Post recovery, obviously, it's a different thing. I now know that I deserve that. I deserve good
Right.
things. So a lot of
Yeah.
it is that shame piece. It's feeling just stuck in the muck of that shame. It's feeling like you don't deserve anything better. It's habits, old unhealthy habits that you
Now, would you,
don't care about changing at
right,
that point.
right, would you consider that like self-sabotage or completely something else entirely?
Um, I mean, that's a good question. I mean, I think it depends, how you look at it. I think for me, I look at that as somebody that, you know, just simply doesn't have the self-esteem and probably also has the trauma and the CPTSD that is
Hmm.
causing the self-esteem from their childhood and maybe even adult trauma. I think that's kind of the connection. So the adult and childhood trauma essentially can create lots and lots of CPTSD, right? That
Right.
that then makes them kind of think in a way of I don't deserve anything better because it affects their self-esteem. They're looking at themselves in a way that they don't deserve a better life, right? So I look at it from that approach, and I can see the self-sabotage approach. Yes, it is. I mean, it is in fact self-sabotaging, right? Yeah.
So, how do you distinguish between a patient who can't change versus one who won't?
I think that the people who change are the people who are ready to change. The
Yeah.
patients who want to
Hmm.
change and are ready to change are the ones who change. And the ones that are not ready to change, they're not willing to take a leap of faith, because that's really what it is at that point with addiction is, can I take this leap of faith that perhaps if I try to get sober, if I try to get into recovery, it may not work, right? There's no guarantee, but if I at least
Right.
try,
Yeah.
and take this leap of faith, maybe it will work. So I think it really boils down to having the courage to change, having the courage
Yeah.
to change and to try on the idea that perhaps I deserve something different and better.
Yeah. No, it's perfect to hear you say it. And I think you're absolutely correct. And what would you say to the healthcare provider, whether it be a doctor, a nurse, a front desk person who's burning out consistently because they keep trying to educate patients who don't seem to want to listen?
That's a good question. Honestly, honest and being as blunt as possible is what has helped me be. I think as helpful as I think and hope I've been with my patients, and that is what I also encourage others to do with their patients, because what I think can happen is we skirt around the issue, but we don't
Yeah.
say what the actual issue is. It's almost like there's a giant elephant in the room and we're not
Hmm.
wanting to face that there's that elephant in the room, right? We're just like, yeah, okay, da da da. Well, maybe you shouldn't have that, whatever it is. But really, it's about, okay, so I'm going to just shoot it to you straight, right? Like, I need you to clean up your diet. I need you to get on a GLP-1. I need you to take your medicine as prescribed. I need you to quit smoking. I need you to quit drinking. We can do, an inpatient rehab program. Like, literally being that level of direct, blunt, and perhaps even harsh. Because that's one of the
Yeah.
things my father actually taught me throughout my life and all of my own anxieties is, my dad's a clinical psychologist. His career was at Vanderbilt for 40 something years. But he always, when I was dealing with insurmountable levels of anxiety, he would always tell me, essentially, you got to push through this. You've got to force yourself to do things you're uncomfortable doing, and you've got to push yourself to do that which you don't feel like you want to do. That's kind of exposure therapy too, is what we would,
Right.
say about that. But that's kind of in the way we're talking about it right now. That's both advice for the patient and the
Hmm.
provider, actually.
Right.
The
Yeah.
provider, just full out face it and say it to them, because what's the worst that could happen? You hurt their feelings, they
Right.
leave, they
Yeah.
they get angry and find another provider. Okay, well, they're
Right. Yeah, no, and I think there's that fear, and that's what I was going to say. It's a great response and great advice because you're absolutely correct. What's the worst that can happen? But
yeah.
indeed, I mean, I think some providers and nursing and or staff are afraid of that. That indeed, you hurt the patient's feelings, and now, and medicine in itself is a service-based business, right? So,
Right.
it is. It's like you can hurt feelings. They storm out. Like you said, they seek other providers, and you like you said, you did the best you could. So.
Yes,
But so you
exactly.
list chronic illness as one of your specialties.
Mhm.
What patterns do you see in patients dealing with long-term physical conditions? And what's the emotional weight of living in a body that feels like it's working against you?
That's such a good question, and I have personal experience with that one too.
Right.
So I dealt with Lyme disease in 2018, and then I'm in recovery from Lyme disease now, thank God. But I still have some flare-up stuff that comes and goes. I've got chronic fatigue, all kinds of issues. But um, I had infertility, all of it. So I do very much understand the the struggle is real when it comes to chronic illness. I think the thing with chronic illness is, if I'm being completely honest, I'm not sure I have really discovered yet the magic way to handle it because I'm still
Right.
kind of going through it. I've had like a
Yeah.
bout with my spine the last like year that has been terrible. I've got a not great spine right now and spinal flare-ups of sciatica, can't walk kind of thing. So it's been a strange time. But that being said, same kind of advice, have to say it, but you have to push yourself and at the same time be kind to yourself. That's what I say about chronic illness. You have to push yourself and be kind to yourself at the same time. I know with my spine back in the ice storm in January, I couldn't walk. I was on crutches. We were displaced from my townhome. I had to get a
Mhm.
place downtown. We're lucky enough to be able to do that, of course. And it was awful. I mean, I couldn't go into work. I had to take FMLA to work from home. I was having to essentially, succumb to this
Yeah.
illness. I was having to
Yeah.
succumb to the medical condition. And then, slowly but surely, ice melts. I'm feeling better. I'm already starting to feel healthier. All of a sudden, the flare up just goes away, right? And now I'm still in pain, but it's a lot less. So it
Yeah.
ebbs and flows. And I kind of
Yeah.
think life is like that, right?
Yeah.
It's hills and
100%.
valleys. It ebbs and flows. So when you're in a flare up of chronic illness, remembering that this too shall pass. It's not going to last forever, right? It's going to get better. It's going to get easier. Now, for things like diabetes, I don't have personal experience with that. Um, so I can't really comment on that. But, I know for these chronic illnesses that flare up, it's a combination of pushing yourself when you can and resting when you absolutely have to, I guess.
Right. Right. No, and actually, interesting fact, I can speak on that. So
Yeah.
I got diagnosed with type 1 diabetes late in my career, probably during my training time. So I wasn't, and again, it's a different way of life. And, a lot of the things you're saying are resonating because indeed, like I was 26 and fit and healthy and got stress and we'll talk about trauma and other things likely shut down my pancreas and among that because nobody else is type 1 diabetic in my family, and so I got to be the lucky one. And so, but like you said, I think it's a matter of when I have bouts of inflammation and bouts of flare-ups, as you said, and it's going to ebb and flow. Like I'm very meticulous and I'm obsessive compulsive about my sugar and keeping it perfect, because I do practice what I preach. But there are weeks where, you look at me and my sugar's through the roof and I can't get it down. And, it's frustrating and it's depressing and, you have to watch what you eat. I exercise and it still won't go down. Like you said, I mean, there's these bouts of flare-ups, right? What am I doing different, right? Like I'm not eating cookies, I'm not eating sugars, I'm eating healthy, I'm living, I'm exercising, I have a positive light. What's going on? I'm not really that stressed all the time. But this too shall pass. You push through it, and knowing that at the end of the day, and being kind to yourself, stuff like this does happen. It does ebb and flow, and you will get better.
That's absolutely
Um,
right. Yeah, thank you for sharing that. Absolutely. I think that's very helpful. And I think it's helpful for providers to talk about
mhm.
their
Oh yeah,
experiences and there be a
yeah,
certain level of self-disclosure there because it makes us seem less godlike and more just like regular old human like,
Right.
right?
Right. And it took me forever to kind of, even through my years of training when everything happened, it took a long time. And, going back into the psychological component of this for me to divulge that kind of information. You would think it would just easily come out. And there was a lot of hiding insulin shots, hiding under the table, going to the bathroom, going outside, going to my car in the middle of dinner. Like when I was with friends, I'm not drinking that cocktail and then going outside, gonna go inject myself type of thing. And indeed, a lot of shame, right? What you do in your niche and specialty. I mean, it's I broke through that and able to talk about it and talk about it with patients and really empathize with what's going on. So
Wonderful. That is wonderful. That has to be a huge gift for them that you
yeah,
share that.
yeah, because a lot of doctors be like, I understand, and I tell people, well, no, I actually truly, I mean, we do understand to a component of it, but I was like, I truly understand, the pain. I've had some neuropathy stuff like deep in the past, of course, but like I said, I understand, what those patients go through.
Gosh, yes, sounds like you do. Thank you for sharing.
Well, thank you. Yeah. So research increasingly shows that trauma lives in the body. How does EMDR help release that? And how does unresolved trauma connect to things like poor diabetes management or chronic non-healing wounds?
So, okay, so EMDR, eye movement desensitization reprocessing. So, this is a fascinating intervention that we can use. It's essentially, we're using what's called bilateral simulation. We can do it even like this butterfly hug, where we're it's forcing our eyes to do this, kind of like it does
Hmm.
in REM sleep during, while we sleep. And essentially,
Hmm.
what it does is it helps our brains reprocess as we go through the memory doing our bilateral simulation. It helps us reprocess the memory in a way in our brain that where it's talked about and it's kind of held in a more positive or neutral core belief.
Yeah.
So we come up with a negative core belief associated with the memory, and then we have a more positive or neutral belief that we want to believe to help reprocess it in the brain. So it's stored in a way in the brain in a manner that makes it less traumatizing to our brains. It's fascinating and it's
Yep.
it's very, very deeply impactful and helpful.
I know. So I was just saying, so with EMDR, how does unresolved trauma connect to things like poor diabetes management or chronic non-healing?
Goodness, that's a great question. I don't know if I know the answer to that. I know that unresolved trauma causes a litany of issues. I do know that, and I'm a believer of that. I don't think all people believe that. I don't think all providers believe that. I don't know if most westernized providers are believe that or were taught that.
Hmm.
And me being on the therapy side of things, I do, having lived through it and having seen my patients go through it. I I don't know the answer except that I think that there's probably an inflammation, um, you know, piece to it. I think that the trauma that we go through is then it's processed and held and stored in our body. Kind of the body keeps the score is the famous book that talks about that. So I think that kind of theory that it kind of like the trauma is held in our bodies, um, and that can essentially it doesn't really go anywhere, so it can turn into chronic inflammation that can then turn into other maladies such as chronic fatigue, etc.
Yeah, and I think, like you said, I think you hit it right. I think Western medicine folks look at that like, I don't know about that, but I
Right.
think there is a component to that. I'm kind of a mix of both worlds, right? So
Yeah.
I do think there's a mixed reality of that, where even me as a doctor, a Western medicine doctor, realizes that chronic illness and chronic trauma and unresolved trauma, like you said, kind of stays in the body's inflammation, and that chronic stress does result in intense inflammation in the body and could spark these flare-ups that we have. I do solely believe in that. I've had patients, believe it or not, that have that frame of mind and kind of opened up that part of my brain. Actually, I used to look at, if folks that say that, like, yeah, I don't know. I don't think that's correct. Medical science doesn't say that. And they look at me like, why does it have to be in a medical book or medical science? Like, I'm a healthy young female who loves to dance who now has widespread inflammation in her body. I remember having that particular patient in her 30s, loved country line dancing, did it for fun and as therapy, of course, and had intense inflammation throughout her entire body. Changed her diet, underwent therapy, lots of, therapy, and she got better. And I was just like, wait, so you didn't get better with my surgery? You didn't get better with any, not that we're big medicine people anyway, but, these medicines, but you got better by changing your diet and going to therapy and opening that up and releasing that trauma, releasing that inflammation slowly.
It's amazing. I love hearing that. That's a success story right there.
It really is. I remember looking at her like, no. I went to school for 12 years to tell you that's not a possibility. I'm going to check your blood markers for, psoriatic arthritis
Yeah,
or, send you to a rheumatologist, right? Like that's a
right.
traditional gold standard of treatment, right? Like I want to get you the help and obviously I'm the foot and ankle guy, but let me pass you over to the rheumatology. I had to go over all your inflammatory markers. Something's going on. But no, like, and we did go that route they were normal. And so, I do have a component in me and in my brain now because of that particular patient where, like you said, it lies deeper. I was like, huh, not all medicine is, some of it's just internal and releasing that internal trauma or internal inflammation and letting it go.
Absolutely. And I think, something should be said about functional medicine and how helpful functional medicine has been. I know it's been very helpful for me. It's, what helped me kind of figure out that I was dealing with Lyme disease, that I was dealing with
Nice.
chronic candida, I was dealing with chronic fatigue, I was dealing with, I think my adrenals were not in a good spot.
Right.
I had hormonal issues, but like it did take seeing a functional medicine provider to really find that out. And of course, that was like 10 years ago. But,
Right.
I can't help but wonder, did some of that happen because of some of the trauma I had gone
Yeah.
through? It's very
Maybe. Yeah.
possible. And
Absolutely.
I also think, to be fair, everyone has had trauma, right?
Yeah. In
Yeah,
some shape or form.
in some
Absolutely.
shape or form.
Oh, I don't. I've never had it. I'm like, no. I mean, in some shape or form, it could be like you said, had an addiction to alcohol, whatever have you, or familial trauma, or just like I said, internal trauma.
Yes.
With things, social media, reality TV nowadays, of course, and, a lot of that stems from all that. I'm a true believer in that. That social media is really it's a blessing. We can talk to each other via computer, right? Even though we're local folks, but at this and we can keep track of each other and you know promote each other. But at the same time, like I'm just like the bullying and things of that
Oh,
nature. I mean, is actually out of
it's
control.
awful. Yeah, that part of social media we need better laws and regulations around that.
100%. Yeah, 100%.
Yeah.
So let me ask you a question. If a patient is sitting in a waiting room right now, such as my afternoon, about to go in to see me for the fourth time with the same wound, what would you want them to hear?
To hear how ready they are to change their lifestyle, their habits. I would want to isolate the problem first, the core problem. So the core problem is what? Is the core problem that they're drinking? Is the core problem that they're smoking? Is it both? Is it diet? I would want to isolate that problem and then find out, are you wanting to change? So are you interested in change in terms of, changing your unhealthy habits? Specifically, are you wanting and willing to get sober? Are you wanting and willing to quit smoking? Are you wanting and willing to work on diet and really committing yourself to this? Because again, it goes back to what I said earlier, that a lot of people feel that there is no other way but the way they're
Right.
doing it because they haven't experienced any other way. So they may not even understand that there is another way, there is another life, there is another option, right? And of course, like we said, the shame kind of compounds that and keeps them stuck. So perhaps even bringing up some of those terms and saying, is your shame keeping you from wanting this?
Yeah.
Is your feeling that health and wellness is not up to you, or is not in your path for whatever reason,
Mhm.
is not an option for you for whatever reason. Maybe being blunt and asking about that could be helpful. And I think it will surprise patients if you kind of utilize that way of, talking about their problems, because it will show them, one, you care that much to put yourself on the line that way, and then two, that you're not here to waste time. You're here to get the
Right.
job done and get it figured
Yeah.
out and help them, right? And that's kind of how I
Yeah.
explain my bluntness with my patients.
Yeah.
I say, we're not here to waste time. We're here to get you, better and
Hmm.
on your way, right?
Yeah.
So
Well said.
that's kind of how I balance the effects of being a little blunt at
Yeah.
times.
No, being blunt is good. It's absolutely being true to yourself. Being blunt to patients is absolutely important.
Yeah.
So, what is one thing a healthcare practice can do tomorrow to better support the behavior health of their patients?
I think being trauma informed is number one. I'm so glad you asked that question, because yes, I that's something I've seen in a lot of offices that I want to kind of shout from the rooftops when I'm at those practices. Trauma informed care. All that means is understanding that a lot of people have been traumatized in different capacities, right? Now, specifically, what I was kind of getting at just then was understanding that I know for me, when, as somebody who is a trauma survivor and a lot of different types of trauma, going to a doctor's office is one of the more traumatizing things that I have to do, or triggering things that I have to do, because of lots of different reasons. But I would imagine other patients feel the same way. So being trauma informed means, you know, hey, how you doing? Checking in, during the procedure. You doing okay? You need a break, you need a breath, you need a glass of water, you need to pause, or are you even in the space to do this today? If you're, kind of having a panic attack or having a severe depression day, um, do you need to reschedule the appointment? Or, tell me what's going on in your mind right now. Are you feeling anxiety? Let's do some deep breathing. Maybe even allowing the patient to do some deep breathing during the procedure. I really find that can be very helpful as a patient myself with a provider. If they're talking the whole time, sometimes that can be helpful. And what could be
Hmm.
even more helpful is letting me breathe during the procedure.
Yeah.
So I
Wonderful.
think being trauma informed and being just kind of psychologically and therapeutically, minded can be
Yeah.
helpful, depending on, of
Yeah.
course, what the medical procedure is. Um, and a lot of women have been put through some unimaginable trauma as well, men as well. Obviously, it's not just women, but a lot of women and men have been. So certain things, I think, in the medical world can make people uncomfortable. I know I had a chiropractor once that kind of got really close to my face during um,
Hmm.
the adjustment, and I just said, "Hey, I've actually got trauma, and this like is making me anxious right now." He was like,
Right.
"Oh,
Right.
thanks for telling me." Very
Yeah.
simple interaction, and then
Yeah.
we went on the rest of our adjustment and days. So, but it's that kind of thing. It's being more open about this stuff rather than kind of keeping it hidden or being shameful about it or acting like it didn't happen. We've all gone through stuff, and I think it's better for us to just kind of say, yeah, we've all gone through stuff. What's your stuff that I need to be aware of in this appointment?
Yeah, no, and those are all excellent things. And as you were kind of going through them, I was just thinking to myself, we're a very procedure-based practice, and I do a lot of procedures bedside, and I find myself instinctively so doing a lot of the things that you said are helpful, and I really, which even hearing from you makes me happy because I do find myself being like, hey, are you in the correct headspace to do this today? Like, let's talk through things. What's on your mind? Even simple ingrown procedures, things like that. I'm like, hey, debriding or repairing a callus or a plantar's wart where I put a blade up to your foot, right? It can bring back trauma. And so I do find myself, hey, I talk through things. I do encourage the patients to breathe and take deep breaths. I do pause in between things like injections and things like that because you're absolutely correct. So I do find myself, and that made me happy because as you were going through them, I was like, check, check. Instinctively, I just do that. I am trauma aware.
Wonderful. That's
So,
wonderful. And also you clearly care about that, right? You
yeah.
clearly
Oh,
care about being that way, and not to say anything unkind about, anybody out there, but not everybody does care about being trauma informed. And I think if you want to have better patient outcomes, perhaps doing a training on trauma informed care, as medical professionals could be
yeah.
helpful, right? Because
No,
it's
that's
clearly
excellent.
something that you care about and that you're passionate about. And I know it's not everybody's.
Yeah,
Um,
no, that's excellent advice, and that's something
yeah.
that our listeners should consider for their practices. Because I know we have listeners from all walks of practice, chiropractic, dentistry, and all walks of surgery life. And so, where can people find you if they want to work with you, or refer someone to you?
Yeah, thank you for asking. So Psychology Today would be probably the main way to reach me. I do have a website on Psychology Today. So just first and last name, Brooke LaBarbera, LCSW, are my credentials, and then my HIPAA compliant email, brooke@therapistbrooke.com.
Wonderful. So, that's for our listeners as well as our other colleagues that are listening, so they can reach out to you or have someone that needs your help themselves or a family member. That's where they can reach you. So, Brooke, this has been an extraordinary conversation. What you've given us today just isn't just insight; it's permission, and permission to see our patients as whole human beings, not just wounds and lab values. So permission to understand that the gap between knowing and doing is not laziness. It's often trauma, fear, and a nervous system that hasn't learned yet that it's safe to change. To everyone listening, whether you're a provider, patient, or someone who loves someone who's struggling, I hope this episode planted something at least, and that the cycle can be broken. It takes the right support, right tools, and someone willing to walk alongside you. So, everybody, with that said, I'm Dr. David Farnan again, and this is MedNation, where we talk about medicine the way it should be talked about, honestly, completely, and with the whole person in mind. Until next time,